It's been a year since the World Health Organization had declared coronavirus outbreak a public health emergency. And of course, they did make a suggestion saying that by the end of the pandemic, we're going to look at a huge surge in cases as far as mental health is concerned. But of course, we have not come to the end of the pandemic, but we're already looking at a huge rise as far as mental health crisis is concerned. As far as city of Bengaluru, right now I'm joined in by two prominent doctors, Dr. Chitra over here who's joining me, developmental pediatrician, and Dr. Satish, clinical psychologist, who's going to tell us about how important and what really is the situation, and also going to tell us about if it is an emergency at this point in time. Well, Dr. Chitra, thank you for joining us. My first question to you is, we understand that nearly 80% of the children today have been negatively affected by COVID. Can you provide us the statistics and also tell us what really is the situation today?
Thank you, Shrija, for inviting me to talk on this very important topic today. I agree with you that this pandemic has had considerable impact on children. It has affected children negatively, and we are looking at several studies published all over the world. Right. But I would like to talk about one study which has pooled the data from all these studies and given us some estimates of the numbers of children that have been affected because of this pandemic. Undoubtedly, there has been an increase in several different conditions like anxiety, depression, sleep problems, inattention, general irritability, fears, and so on in children all over the world. And the same applies to for our Indian children and our local children as well, because it's not something that they are going to react in any different ways. So what do these studies tell us? The studies are telling us that there is an increase in the mental health issues of caregivers, which is also going to affect the children. Do you know that 50% of caregivers are having anxieties, and more than 25%, almost 27% of caregivers are reporting depression? So this is not a small figure, and any impact of this is definitely going to be felt by the children also. So 34% of children are having anxiety features, and 42% of children are reporting depression. They are reporting fears related to COVID. They have sleep disturbances. More than 30% are having sleep disturbances and inattention. So to summarize that, if you look at the number of children in India and extrapolate it to the numbers, we have millions of children who are being affected because of this COVID pandemic in their mental health.
Right.
Yeah.
So do you think we understand it's a pandemic situation, and everybody's been panicking about it, and of course, do you believe that at this point in time they should actually be given more attention? But we think at some point they are still being neglected. What can really be done to bridge that gap?
See, there is something that we have to understand, how these kind of situations can have an effect on children. Right. That awareness is very important. So why is it so? Because children are not going to come and tell us what they are feeling, how they are feeling, and why they are feeling in those particular ways. Okay? Instead, they are going to react in different, behave in certain ways that may be, clinginess, they may be irritability, they may be anger, they may be separation anxiety. There are also reports that there may be new onset bedwetting in children. Right. And all these things may be related to their mental health issues. Okay, so first thing is the awareness, and second thing is for parents to understand how to positively support their children when they are feeling in these kind of ways, how they can support their emotions, how they can reassure them. For this, certain positive parenting strategies are very important, and parents have to talk to the children about their fears. And also another very important aspect is that we have to understand that adults, parents themselves are going through a lot. They have their own anxieties and fears and pressures to deal with. So they need a lot of self-care practices like mindfulness, yoga, relaxation techniques, taking care of their own physical health, exercise, sleep routines, and things like that. And they have to incorporate the same for their children also. Right. So having regular routines and structure for their child, having good nutrition, physical exercise, which is very important, cut down on screen time, develop other behaviors and habits which are creativity, art materials, artwork, music, painting. All these things help with stress reduction for children, and it gives them an outlet for their feelings also, isn't it?
Right.
So these are the other practices they have to inculcate and encourage their children to follow. Outdoor activity is a must. Sleep hygiene is very important. Getting adequate hours of sleep, making sure that they go to bed on time, wake up on time, and follow their routines. And these are some of the aspects, I think, and very important, they have to maintain their social contact.
Right.
What has happened in this situation is children are not seeing their friends, they are not playing adequately with their peers.
Yes, they are all indoors, right?
Exactly. So maintain some contact, through phone calls, through FaceTime videos, talking to relatives and friends, making teachers, making sure that they get the regular dose of social interaction.
True.
Play, etc., is really important for the mental well-being of children, I think.
Absolutely. Well, if I could actually go to Dr. Satish as well, taking it forward from Dr. Chitra, what she did mention, of course, it should be the parents, because as it is before, the pre-COVID that we're talking about, as it is, were reporting mental health in children, and that also the reasons were that parents were not really paying much attention. But now, coming to a pandemic situation, you already have still in adults, adolescents also, they're still reporting mental stress. I have come across another data from the government itself, Karnataka government, which talks about, they've been getting several calls talking about, marital stress, discords. So how at the time when you're talking about something like this, we understand children have been negatively impacted even because of that. Now, can you throw us some light on as far as adults and adolescents are concerned?
Sure. Thank you, Srija, and thank you, Dr. Chitra. When we talk about adolescents, probably the first thing that strikes my mind is internet addiction, how people are getting too much into technology. And probably earlier, people were more into gaming, watching videos. But these days, the extra pressure on them is the online classes. And that they're into online classes for longer hours. The screen time has increased. Now, ultimately, with the screen time, they have developed a lot of musculoskeletal pain, as well as they have developed anxiety, they have developed sadness, and one prominent thing that they have developed is existential crisis. Well, why, if you ask me?
Well, that's serious.
Yeah, if you ask me why, after 11 and 12, everyone knows that is going to be the beginning of their career. Like, I'm going to choose my graduation, which is going to be my career in the future. So everyone has this question of what after +2. Well, I had a couple of my colleagues who were supposed to join certain universities in US and Australia, but as soon as the lockdown happened, people were clueless. And all their parents would want them to know is what next. Well, children did not have any idea of what they're going to do next, and parents kept on asking them more and more about what you are going to do next. Well, existential crisis is severe when we talk about the older adolescent and the young adults, because that's where people either complete their +2 or graduation or masters, and they need to enter into the global economy market. I mean, finding a jobs and settling down. So the question of what next, what am I going to do next? Many people got their admissions cancelled, and that's one of the biggest thing. Well, and on a larger scale, if you look at what really changed in the post-COVID situation is, children being at home and witnessing their parental dynamics. Well, if you ask me, parental dynamics is how parents are. Most of the parents lately are working, but now because they're working from home, parental differences came closer. Like, people started arguing with each other, they started talking, discussing, and turned into disagreements. Everything happening in front of the adolescent children also could be one of the reasons why their substance dependence increased. So the adolescents and young adults, because of boredom, because of pressure, and also because of the parental marital discord, started depending more on alcohol and cannabis.
Yes, I was just coming to that, Dr. Satish. We understand that the withdrawal symptoms have increased, especially during the first 3 months. We're talking about during the lockdown period, probably from March till about May or June, for that matter. We have seen a rise in at least about 40 to 50%, right?
Sure. Yes. Yeah, so data shows that how, especially adolescent and young adults, these were the group where people were highly vulnerable for substance, especially cannabis. because cannabis is something that can be available for this particular age group, that is older adolescents and young adults. And because of the lockdown, well, there was no much prior information given, and lockdown happened all of a sudden for at least 3 months. So people did not have substance with them. And that's where they developed withdrawal symptoms. So a lot of psychiatrists were looking at the consultations, especially for the withdrawal symptoms. Many institutions, even World Health Organization, came up with modules to work with the adolescent and young adults, especially on the withdrawal symptoms, that is psychological support for the withdrawal symptoms. Well, that is not certainly only for the young adults and adolescents, even for the elderly people too. But this group were the people who were severely affected because of the withdrawal symptoms, they weren't able to focus much on what to do next. That is where I spoke about the existential crisis. So they just felt blank. They didn't know what next. They were clueless, to be very honest.
Is there a data that you can support if you're talking about, the pre-COVID and the post-COVID, so that, the viewers can have an idea of what really are we talking about in terms of surge that we're looking at?
Well, there are a lot of studies. Well, maybe talking about the World Health Organization themselves. The survey given by the World Health Organization talks about the increase in the surge in the mental health aspects, as well as the statistics. And they were also very clear about what sort of issues, and even to some extent they were even talking about what next. Probably that's what we will be discussing, what next. And they also spoke about what could be the possible reasons, about probably what could have been the reason for their increase in anxiety, probably again existential crisis. Well, the major drift, I would say, could be the online classes. I was talking to my students, saying, if I could be a student, if I was a student and if I was into online education, probably I would have lost attention very soon. My hands would have picked up phone, probably I would have been in YouTube. I would have definitely done that, because it's a new thing for me to be into online classes. Maybe I was never trained. I was never told how to be a part of this system. So I always feel very bad, because they were not really trained, or there was not much of support given, and they were just pushed into it. And probably 7 to 8 hours a day of online classes is really stressful.
Well, coming to that, I just want to understand from your end, this is on a personal level, because you're a clinical psychologist. Can you also tell us that if you have seen an increase in cases, patients coming to you, and what are the kind of cases that you have witnessed? Is there a shift in the trend that you're looking at?
Okay, I would say it's mostly the internet addiction.
Okay.
And substance, especially cannabis. How parents caught their children smoking in toilets, hiding from them, and they also caught their children with the marijuana under the beds, in the cupboards. So earlier probably this wasn't seen, just because adolescents or young adults could have passed on substance between each others, but now they were keeping at home and they got caught. So most of the parents were really surprised. They were shocked. They were even saying that I never expected my son could do this. Well, now not sure whom to blame. Everyone has their own set of stress. Talking about the students, especially who are in +2 or probably 11 and 12, and who are into graduation, have the biggest stress ever, and probably they felt being at home.
What about adults, doctor?
Well, that's a different dynamics. When you talk about the adults, altogether a different dynamics. Adults, well, if you ask a person who has social anxiety during the college days, the person would definitely skip going onto the stage. A person who had stage fear, just because he can do. But in a workplace, a person can never say, I have stage fear, I cannot talk to a person. Which means adults are somehow learning to cope. Maybe talking about the neuroplasticity, they're developing a different set of learning methodologies, so they kind of adapt. So the adaptation is the factor.
Right. But how has mental health, we're talking about the mental health, how has it affected in terms of, looking at adults here?
Well, all that an adult could do is throw the frustration on others, because they have to cope up with the stressor, they have to deal with everything, and ultimately the rise in adult issues are marital conflict, domestic violence. If you ask me what I would do to remove my frustration, the moment I enter my home, I am ashamed to talk about it, but sometimes I throw my anxieties or irritation on my mother. It is believed that every person throws their irritation on their mother and after getting married on their wife. So that's how the domestic violence increases. So that is the dynamics that happens with the adults. Because they deal with everything over the day-to-day issues, and ultimately what they do is, it's like sublime. It's like, you show your stressor onto someone whom you know are safer. Hence, the irritation or anger management is the thing that I get most adults coming to me for. They just talk about, I'm not able to handle my anger, I'm not able to hold on to my irritation, and how do I deal with them? So that's the surgeon.
Well, thank you, Dr. Satish, for that, for those inputs. Coming back to you, Dr. Chitra, the most important thing that we are looking at here is the kids, the children. What next? We want more to know about what can the medical fraternity do over here. In fact, there are several kids who don't really, when you have at home, when the parents are completely failing to notice this, what can really be done to bring this out and, so that it can be fixed?
Yeah, Srija, that's a very, very important question. We have to understand that kids are going through a lot. Yes. I just want to quote another little figure here that, that 70 to 90% of children have had some aspect of deterioration in their behavior. And this is being seen more so in children who have some pre-existing problems like ADHD or autism or learning disability and so on. Given the situation, you can very much understand that schools are closed. These children are not getting the support that they were getting either from therapies or from schools and so on. So it's been really, really hard for them. So again, I would say that, that awareness is really important, that parents have to understand that children are going through a lot. Patience and support is very important for children at this point of time. At the same time, they have to understand when things go out of hand. For example, if there are persistent symptoms, if children are not getting better, they are persistently sad or they are persistently irritable, that is persisting for days and weeks together. There are changes in their eating habits, there are changes in their sleep habits, or they are lagging behind developmentally, their speech is not improving, the language is not improving, they are having speech, young children may be having speech delays. So when these situations are seen, they should try and seek out some professional help for their children. This is very important. Now, we are having, this is a very important initiative from your side to raise an awareness that mental health issues are increasing. And so, this itself is a very good initiative, I think, to make parents aware and, and they need to know the red flags when they should seek out the professional help. And another aspect is definitely that children are losing out on their academics, and there is another study that has come up from the Azim Premji University, and I really want to mention this because this is very staggering that 90% of children have had some loss of their ability in their language related to what they knew before in the previous year, and 80% of children have had some loss of their ability in mathematics. So this is going to be a big issue when schools reopen. So I want to talk to parents and tell them, please support your children in their learning. If nothing, we have to keep reading with them. Reading is a very, very important aspect that every parent can do with their children at whatever ages they are on. Encourage reading. That improves their language, improves their vocabulary, improves their comprehension. This is one thing that you have to do to make sure that they don't slip up in their learning. That is reading to them and reading with them on a daily basis. The second thing is, of course, practice their basic mathematical skills if possible. Do it on a daily basis with day-to-day activities, incorporate it in your day-to-day things. Say, for example, when you're going for shopping, calculate the bill, and you're doing, how much, calculate a menu, and how many people are there, and how many things that you need to purchase, and so on. So do it on a daily basis, and that's really very important. And from other aspects, now people can seek out clinical psychologists. Online consultations have become the norm. People are able to access but they should know whom to access, when they are in mental distress. Seek out a clinical psychologist, seek out counselors, they can help you online, they can follow up with them, you know, for their subsequent sessions as well, give you some coping strategies, how to cope up with your distress, and what are the specific steps to take. And I think from medical point of view, these are some of the steps that we are taking, and more such sessions, more such you know, conversations need to take place in order to sensitize the people that these are the situations that we are facing from mental health aspect, from developmental aspect for children, from academic aspects for children, and this in turn is going to continue and have other you know, snowballing effect.
Well, one final question to you, Dr. Chitra. We want to understand, you know, personally, what is the trend that you have witnessed? Because have you come across any such cases which was way different from, you know, the pre-COVID? Have you dealt with any such case like that?
Yeah, definitely. You know, in pre-COVID, people were, you know, coming to the hospital, they were seeking out help, they were talking to the doctors, but now because of fear of COVID coming out, and so they are not seeking help at the right time. So we are seeing children who have had, you know, lost out on time, and therefore they have not progressed in their development, they have not, you know, improved in their speech, they're having speech delays, they're having difficulties in social situations because they've been deprived of opportunities to deal with, you know, or to spend time with children of their own age group, with the teachers, with other adults and so on. So their social skills are definitely getting affected, and they are getting more and more involved with screens, which is very concerning, because we know that the more number of hours the children spend, you know, with their screens, like, you know, tabs and mobile screens and video games and TV viewing and so on, the bigger impact it has on child development, you know.
Yes.
So many aspects of it that we can keep talking about, and we are seeing the impact of these on children, and we are going to see it a bit more in the coming months, and until the situation becomes more normal, and we need to be ready and prepared for that, I think.
Yes, of course. We haven't even come to the end of the pandemic, and we are already reporting a staggering number of cases as far as children, whether it's children, adults or adolescents are concerned. Well, of course, thank you to both of you all joining us here on our show. And of course, you all provided wider inputs along with some of the data, which is of course shocking as well. And yes, of course, just like how Dr. Chitra and Dr. Satish did point to us, saying that there is a staggering number that's coming out here in the open as far as mental health is concerned. When you're talking about kids, remember, they are in fact staying indoors, which is negatively impacting them. They are spending more screen time, and it's affecting as far as the developmental issues are concerned. In coming to adults and adolescents, we're of course talking about where, just like how Dr. Satish told us, that they are spending more time and especially online classes. They're not talking to anybody outside. So of course, mental health is real, and all that the doctors over here are telling us is that seek assistance, and that's the only way to come out of it. With video journalist Santosh, this is Shrija reporting for Mirror Now in Bengaluru.